So I think women have an advantage in this department in a way because we go to an OBGYN pretty much at least once a year. And we do that in addition to our primary care physician. So this is a person who, if you get a good one, takes your overall health as a woman into consideration. It's not just, forgive me, a vag doctor. She's checking out the whole woman, your energy levels, your sleep, the breasts, yes, down south in Rio, all the stuff. But like whenever I leave my GYN, I feel like, okay, I'm well looked after. She wants to know everything. She wants to know about my blood pressure. She wants to everything. And I feel like there's not, men don't really have that. They don't have that extra on top of the primary care physician. I think they do the turn your head and cough thing when they go to the primary care physician. But for most men, that's about it. Am I right?
So I think you nailed it. I mean, you have to think about this. Erectile dysfunction affects 40% of men at 40, 50% at 50, 60 at 60, 70 at 70. You live long enough, a man's going to get erectile dysfunction. The problem is that many men are embarrassed to talk about it. I think one of the best studies I've ever seen came out last year, 1,500 men between the ages of 18 and 80, and they put out a survey. And what they found was that 40% of men had some degree of sexual dysfunction, but 50% of them said, I don't know where to get the help. 70% said, I wish I could get the help. And what was surprising is that 53% of those patients didn't even tell their physician. Now, I think one of the problems is if you look at physicians, they don't ask the question, do you have erectile dysfunction? My wife is a primary care physician, and she says, look, I have about 15 minutes to go through diabetes, hypertension, obesity. Erectile dysfunction tends to be at the bottom of the list. So again, it's a patient embarrassment problem, and physicians aren't asking about it.
That's so troubling because not only does it affect your relationship and your happiness and your wellness, but now in reading up for today, I realized it actually can be a clue that something else is wrong, like potential heart disease even could be related to, in particular, ED. Is that correct?
You're so right. So I think that one of the best barometers of a man's health is his sexual health. Why? Because it not only does it encompass your physical health, but it also encompasses your mental health. And so sexual health is one of the best barometers of overall health. But you bring up a very good point. There was a study that came out in 2005 that showed if a man gets erectile dysfunction today, 15% of them will have a heart attack within 7 years, 15%, which is quite large. That same year, other studies came out showing that if a man has a heart attack, typically 39 months prior, he started developing erectile dysfunction. And we know this because the coronary arteries are much smaller, 1 to 2 millimeters. The penile arteries are much smaller, 1 to 2 millimeters compared to the coronary arteries. So if you're going to block an artery, you're more likely to block the penile artery before you block the coronary arteries. So I really do think that, a young man who has ED and no other signs, this could be one of the first signs of having a potential MI in the future.
And if you are too embarrassed to talk to your doctor about it, let's say your doctor is a female, then get a male doctor or just somehow work up the nerve because now you're talking about, your actual life. And what a great canary in the coal mine, if you just it's not great to have ED, of course, but much rather have to fix that problem than have to fix a heart attack.
Right.
I read the following. Is it true? The penis works on blood pressure.
Yes, so it's important that, when the important part of the penis is blood going in and blood going out. And so the way you get erectile dysfunction is not enough blood coming in or the blood's coming out too fast. And so it's a very clever system. The artery goes down the center and then the veins are on the periphery. And so the first sign of erectile dysfunction is typically the blood is coming out too fast. This is called venous leak. So what does the patient tell you? They say, Doc, I can get the erection, but I can't maintain the erection. He's telling you, look, I got one of the first signs of ED, which is called venous leak. So there's many ways to fix this. One way to fix it is to increase the blood flow. And that's what many of these pills do, like Viagra or injections, or to decrease the outflow. But again, this is the most common type is venous leak.
And this is so you don't want to just get a prescription for Viagra. You want to figure out what's going on. That could fix the symptom, but if this is linked to high blood pressure or a heart disease, you need to get to the bottom of it. It's not a matter of just getting your friend's Viagra. You really need to know. Well, so let's talk about erectile dysfunction because I can say I'm sure, thankfully, I haven't had this issue in my life. My husband and I are still relatively young. But I think as a woman, I would start blaming myself if my husband had
Right.
this. I'd be like, something happened. I gained weight. And then I can see how this would turn into an issue really quickly between the couple.
Yes, Megan, ED has a devastating impact, not only on the patient, but on the couple. And I didn't go through these statistics, but 30% of men, 33% of men who have erectile dysfunction are severely depressed because they have ED. 37% of men who have ED have severe anxiety. And you talked about this earlier, but we know that couples that engage in sexual activity have a significant improvement in the quality of the relationship, say 2x. Those that do not engage in sexual activity have a significant decrease in the quality of the relationship, almost 4x, so double. So again, sexuality is really important for the couple. When a man starts getting erectile dysfunction, something very interesting happens. He starts avoiding sex because he says, what's the point of engaging in sexual activity if it's going to maybe work or not work? I'm tired. It's 10 o'clock at night. I might as well go to sleep. We call this subconscious aversion. They tend to avoid it. And so the female partner or the partner in general takes this as rejection. And she says, or he says, why are they not interested? What is going on? But inside the brain, the patient's saying, I just don't want to go through all the frustration of this not working.
My gosh, it's reminding me, this is an off-color story, so forgive me, but a friend of mine once had a sexual interlude with a man. P.S. It turned out he was gay, so this is why the problem was manifesting. But he couldn't get an erection, and finally, after a long time, he got one. And I remember her telling me about it after the fact, and her statement was, "It should come to me in this condition." And I think there is an expectation in normal relationships where the person is not secretly desiring somebody of the opposite sex by women that it should come to me in this condition without thinking, oh my God, maybe he has a problem. Like maybe, what if I were just really cool about this issue and we talked about it and I were supportive of him in fixing it. So, but that, I guess as a doctor, that would make you ask, is this a new thing? Or is this something you've always struggled with?
Right. So remember that as men get older, they acquire comorbid conditions. Diabetes, an epidemic in the United States, obesity, metabolic syndrome. Think of other risk factors like smoking, certain medications like a beta blocker. How many people are on a beta blocker? It's notorious for causing erectile dysfunction. Remember, beta blockers are used for hypertension, thiazides. So as we get older, as we develop new conditions, we start taking new medications that can make a significant impairment on erectile function, but we start getting more conditions that are associated with ED. So this is the issue. I forgot to mention one other thing earlier. In that survey I talked about, 44% of men did not mention to their partner that they had ED. Now you may say, how did they not mention it? What they do is they just stop engaging in sexual activity, right? Which is a problem. But as these men get older and they start developing more and more sexual dysfunction, our job is to try to find out what we can reversible causes of ED. Now, my wish is that, lifestyle modification, diet, exercise, sleep, and stress reduction. Again, diet, exercise, sleep, and stress reduction are very powerful tools in preventing a man from ever developing erectile dysfunction. So to me, that's a form of preventing ED.
So and those are the key things to every area
Yes.
of well-being. Like if you improve those four things, everything about your life will improve, not the least of which is your longevity. And you know what I recently discovered is I wear this Fitbit now. This is in honor of my friend's son, the orange band, but this is my Fitbit. And the reason I've been wearing this Fitbit nonstop is because your Fitbit, if you wear it overnight, will monitor your sleep. And it will not just monitor how many hours of sleep you got, it'll tell you how many hours of REM sleep you got and how many hours of deep sleep you got, which are not the same thing. And if you can get like an hour 15 of REM sleep, and if you can get 2 hours, like over an hour and a half of deep sleep, that's awesome. And if you're not getting that, you could do something to address it. There are all sorts of things. You don't have to go on a prescription medication. You could exercise more. You could take whatever, tryptophan, that stuff. That's a supplement. There's all sorts but like fixing sleep is, I would say, like one of the first things, no?
Right. So you nailed it. So I take care of a lot of patients and they tend to say, look, doc, I eat healthy and I exercise, but they don't sleep and they're stressed through the roof. And that's 50% of it. It's all four. If you decided today that you were going to focus on just one of them, diet, exercise, sleep, or stress reduction, it would have a profound effect on your quality of life. And imagine if you did all four. And so what you just said is exactly what I tell my patients. I don't have a pill stronger on the planet, stronger than diet, exercise, sleep, and stress reduction. Not only will it help your physical health, but actually it helps your sexual health as well. And fatigue, poor sleep, is one of the reasons why many patients don't engage sexual activity. Poor sleep, increased fatigue, lower libido.
And then if you have poor sleep, you tend to make, I think, poorer food choices the next day, right? Because
That's exactly right.
Your will powers down. You don't feel good. You seek comfort in food. And so it's like a downward spiral.
It's a snowball effect, right? It's a snowball effect because they're all interrelated, right? So if you exercise, you'll sleep better. If you sleep better, you'll eat better food. And it's all related. If you sleep better, exercise, and eat good food, you tend to see stress as not as big as it would be, right? So one of the big reasons why we see stress as such a big thing is because we're fatigued. If you're not so fatigued, stress typically doesn't look as big. So it's all related. And so when patients come in and they say, "Doc, just give me the Viagra and the testosterone," I say, there's more to it than this. This is a partnership, and your 50% is diet, exercise, sleep, and stress. My job is to modify and make sure that your hormones and your medical condition is optimized. But together, it's a partnership. And if we do the partnership, those patients tend to do the best.
So if you are suffering from ED, any form of it, like a light form or a severe form, and you go to the doctor, he's going to tell you, think about those modifications in lifestyle. And then what's the first line medical defense? Is it Viagra? And also now I read about Cialis. Is that basically the same thing as Viagra? What's that?
Let's talk about it. So think of it like three different categories. And the first category is going to be medications. And there are four types of medications, but they're all like Viagra. There's Viagra, there's Cialis, there's Levitra, and there's Stendra, four different types of medications. Stendra has the fastest half-life, and so it has an onset as actually as fast as 15 minutes. Cialis has the longest half-life, so it's 17 hours. So many patients will take a daily Cialis every day, and it lasts throughout the day. And so these medications.
Wait, what does that mean? What does that mean? Because of course, as a woman, I'm like, no woman wants to see a 17-hour erection coming at her.
Yeah, great question. So this is very important. So Cialis is the only medication that has a daily dose and an on-demand dose. And the daily dose is a 5 milligram dose that you take every day. And the on-demand dose is a 20 milligram dose that you take several hours before sex. One of my favorite medications is that daily dose of Cialis. Why? Because when a patient takes that daily dose of Cialis every day, over time, the muscle in the penis becomes stronger. To me, it's like rehab. It's making the penis stronger. Let's be honest. Viagra is not a cure for erectile dysfunction, because if you remember, I said ED 40% at 40, 50% at 50, 60% at 60. Viagra only covers your problem that night. It doesn't cure you. It just covers your problem while the disease gets worse every day. So giving someone daily Cialis to me is more like a curative, preventative measure. So most of my patients are on daily Cialis every day. What's nice about it is when they engage in sexual activity, many of them don't need to take a pill. They're always ready. And that really works well for young patients who like the spontaneity. So again, daily Cialis, very effective.
And what about those other two that you mentioned? I'd never heard of those. Why would you go with those two over the first two that are better known?
Yeah. So one of them is cost. So remember that these used to be very expensive. It could be $20, $30 a pill. But if you've heard of GoodRx, if you've heard of Mark Cuban's new company, Cost Plus, the medications are now very cheap. You can get 90 pills for less than $20. Anybody can. So that's very affordable. But in the past, we had to work with the costs. The newer one you have not heard of probably was Avanafil, which came out in 2015. So it's the newest one that came out. But again, we have 4 pills that we can use to treat men for erectile dysfunction. If one doesn't work, you can always just switch it for another one. So sometimes some patients respond better to one than the other, and side effect profile. Now, in this first category, I also like to offer patients a sex therapist, because sex therapists are extremely effective in helping with this condition. And we also want to consider lifestyle modification, stop your smoking, change your medications. There's also something called a vacuum erection device, which many men can use. It's exactly what it sounds like. It's a vacuum. It brings in suction, makes the penis erect. They place a band at the base of the penis, and it maintains the erection. Sometimes if those are not effective, I'll go into something called penile injections. Those are very effective. It's a small injection that the patient places at the base of the penis, and it induces an erection within about 5 to 10 minutes. The erections can last about 1 to 2 hours. So even if the man has an orgasm, it still stays erect. And then the last option, which is a great option, is something called the penile prosthesis. Now, the penile prosthesis was invented exactly 50 years ago here at my institution at Baylor by a guy named Dr. Brantley Scott, and now it's used throughout the world. And it's a very effective form of treatment for erectile dysfunction.
What is it?
So it's a surgery that we do. I typically perform these surgeries. It takes about 45 minutes to do the procedure. And it has, if you think about the anatomy of the penis, there are 2 cylinders, and each of those cylinders have muscle and carry blood in them. So when the man gets erect, those cylinders expand. And what we're essentially doing is putting balloons inside those cylinders. There's a small pump that goes in the scrotum, and there's what we call a small reservoir that goes behind the pubic bone that holds water, let's say normal saline. So when a man wants to engage in sexual activity, he just pumps the pump in the scrotum. It fills those balloons and gives him a very good erection. He engages in sexual activity as long as he wants. When he finishes engaging in sexual activity, he'll release the pump, and all that fluid will go back into the reservoir. So it's extremely effective. If a man took off his clothes, you would not be able to tell that he has a penile prosthesis. But really what it's done is revolutionize the way we treat ED, because essentially a man can have an erection as long as he wants, whenever he wants. And it's very effective.
Well, I mean, if you were having sex with a man, would you know that there was a pump?
Well, many women would state as that they really can't tell the difference when a man has a penile prosthesis. If a woman was to touch his scrotum, she would be able to tell that there was a pump there. But during sexual activity, it's reported that the sensation is the same. The satisfaction rate is very high with the penile prosthesis, over 90% for patient and partner with the penile prosthesis. And that's higher than almost any other treatment I can offer a man.
How painful is that surgery and the recovery from those implants for the man?
Yeah, so you'll be surprised. It's very well tolerated. I tell patients to take the first week off, and during the second week, you're about 50%. By the third week, you're back into your normal activity. We typically have the patients come back in about 2 weeks and cycle the pump. But with new techniques in pain control, it is very well tolerated.
All right. Now, you mentioned sex therapist. What is a sex therapist? And how could they help you with ED?
Right. So many patients have psychogenic ED, and these are younger patients who have psychogenic ED typically. So maybe it was a bad relationship. Maybe it was something that went on, stress. And what they do is they work through the reason why you have sexual dysfunction and see if there's something that they can do psychologically to help you. Sometimes they give you homework, you and the partner. They like to sometimes meet with you and the partner to talk about ways to slowly get back into engaging in sexual activity. But they can be very effective. The only problem is that when most men come into my clinic, they say, "Doc, just give me the pill. I don't have time for a sex therapist." What's revolutionized our ability to treat men with sex therapy is the internet. And during COVID, many of the sex therapists were offering this benefit through Zoom. And so this has really been great because men say, "Look, I don't want to drive in and go into a sex therapist's office," but a lot of them say, "I don't mind doing a Zoom call." And that's been very helpful.
I'm curious, is it usually the woman or is it usually the man, if you know, who suggests a sex therapist?
Well, so I suggest the sex therapist to both women and men, and women typically take me up on the offer. Men typically don't, which is unfortunate. Now, sometimes when a woman will go to a sex therapist, the sex therapist will ask if you can bring your partner, and sometimes the partner will go. But the sex therapist is very helpful to just talk through the issues. Sometimes, there are many psychological issues that could be affecting or withholding the patient from engaging in sexual activity. And it's very healthy to talk about it. You'll be surprised how many times couples don't communicate or talk about their sexual problems with one another.
Oh, no, I wouldn't be surprised. I remember seeing some comedian talk about how it was a guy, and he was saying, "For the love of God, would you women please give us direction in the middle of sex, whether it's up or down, give us some direction. We won't even pull over to ask for directions because we rely on only maps. We're too embarrassed to say we're lost. Never mind down there. We're definitely not going to say we're lost. So just volunteer direction." So no, I wouldn't be shocked. That sounds just right. What about insurance? Does insurance cover any of this? Viagra, Cialis, sex therapy, any of it?
What you'd be surprised. So one of the best payers for the penile prosthesis is Medicare, right? So Medicare, the government, is a very good payer. So a lot of patients are 63, they're 64, they're just waiting to turn 65 so they can get their penile prosthesis, which is very interesting. But now it doesn't matter about insurance for the oral pills. Because as I mentioned earlier, you can pay cash. Mark Cuban's Cost Plus, I looked last, it was $9 for 90 pills, which was amazing. Cash, no insurance. Good RX, and $20 for 90 pills. So that's very affordable for most Americans to pay this amount for the medication. So that has been very, very helpful. What's also interesting, the penile injections I mentioned, these are compounded and they come out to about $3 an injection. So again, very affordable. So, the take-home message is there are treatments out there, and they're affordable treatments if someone out there is suffering from erectile dysfunction.
Now, what are these? I have listed here other treatment options: stem cells, PRP, and shock therapy. What's that about?
We have to talk about this because over the past 10 years, there has been a boom in these three areas. As I mentioned earlier, there's no real cure for ED, but over the past 10 years, there's been a quest to cure or reverse erectile dysfunction. And the way that this has been going has been looking at stem cell therapy, shockwave therapy, and PRP. Let's first talk about shockwave therapy because it's the most commonly used. Back in 2010, a European physician by the name of Dr. Vardy started taking a shockwave machine, very similar to what we use for kidney stones, a shockwave machine, and applying those shocks to the penis. Now, I'll be honest, when I first saw that, I thought it was ridiculous. This doesn't make any sense, but it's actually brilliant. Because what you're doing when you give those shocks to the penile tissue is you're tricking the body to think that there's some kind of trauma. When the body thinks that there's some kind of trauma, it starts bringing in growth factors, new blood vessels, stem cells to heal that area. And so there's been a huge boom in the US to use shock waves to help reverse and cure ED. The problem is that there are different types of machines. They're class 1 machines that actually don't do very much at all, almost nothing. And these are called radial machines. And there are class 2 machines and class 3 machines that are actually are more effective. And many providers are buying the class 1 machines and charging patients $500 to $1,000 a treatment when it really doesn't do very much at all. And that's my concern. So if you're going to use a machine, you want to use one that's focal. We like the electrohydraulic, the electromagnetic machines. You just want to use it where it's legitimate. And I just want to quantify that this is still investigational. This is not mainstream. So more studies need to be done to say that we can call this standard of care. So more studies need to be done. So shockwave may be beneficial. I have to mention a very cool phenomenon. So if you think about ED, there's a very large placebo effect. If I give 100 men a sugar pill and I tell them, you're going to have the best erections of your life if I give you the sugar pill, 30% of men come back and say, this was the best erection I ever had, because there's a huge placebo effect when it comes to sexual dysfunction. And so if you're giving someone a shockwave that doesn't do anything, you better believe 30% of people are telling their friends, this is the best thing since sliced bread, when really it's a large placebo effect.
Yes, your description of it reminds me of what we women are doing to our faces. You can get the micro needling, which is like you're damaging your face, and that's supposed to stimulate collagen and make the face younger. It's kind of a similar concept, like to stimulate, not estrogen. That's not what's coming out, but something else that's going to help the ED.
Yes. Stem cells is the other one. I just got to mention that. We've been using stem cells for a long time. We were the first to use an FDA-approved product for stem cells, where you take the fat out of the man's abdomen, you put it into a machine. The machine's called an accelerator. It would give us 37 to 50 million stem cells. We'd inject those stem cells into the penile tissue, and we would see if it would improve erectile function. So there may be some potential benefit with stem cells, but again, it's still investigational. And then the last one is PRP. Now, PRP has the least data. And PRP is really platelet-rich plasma. And some people may call it the Priapus shot or the P shot. And the rate for that is anywhere from $1,500 to $3,000 an injection. But it really has the least amount of data to support it. So I just caution a lot of patients. They come in and they say, I spent $3,000 for the P shot. I spent $6,000 for this shockwave, and nothing's really happened. And so you just got to be careful to counsel that there may be some potential benefit, but you don't want to say that, this is main treatment as of today.
That middle one, it's like, well, so you didn't solve your ED, but your waist is slimmer. Your belly's flatter because
Stem cells.
you had like
Yeah.
tiny,
Yeah.
tiny little lipo going there. All right, well, all of that is so interesting. Now, in terms of prevention, you told Peter Attia, patients who are not using the penile muscle will start getting atrophy. That's terrifying. So it's a use it or lose it situation. What does that mean for guys who aren't partnered up or don't have anybody interested in them for whatever reason? It's just constant masturbation. How often? Like, what does this mean?
You nailed it. So that's exactly right. So think of the two penile muscles are just two muscles running in parallel, just muscles, just like your arm has a muscle. So if you lift weights every day with your arm, what happens? It hypertrophies and gets bigger. If I put your arm in a cast for 6 months and I take the cast off, it atrophies, right? So atrophy means that you weren't using it and the muscle contracts. One of the best examples I can give you is we see men after a radical prostatectomy. That's prostate cancer surgery. Second most common cause of cancer in the world in men. This year will be 300,000, almost 300,000 men diagnosed. When you have that surgery, many times men will have erectile dysfunction immediately right after. And what you'll see some atrophy of the penile tissue. And so the goal is to try to continue to keep that muscle going. You can use a vacuum erection device. I really like them using the daily Cialis. That makes a big impact in my opinion. And you're right, more sexual activity keeps the tissue healthy. As men stop having sexual activity, and then it becomes more and more difficult to get the erection. As it becomes more difficult to get the erection, they have less sexual activity, and it just spirals, right? So it's very important to use it or lose it, just like you mentioned.
Well, of course, that has everybody asking how often, right? Because this is most men want it more than the women are willing to do it, just as a general biological evolutionary principle. But like, what does that mean? Is there a number you can put on that? How often must they use it?
Yeah, so there's not a number to show, but I can just tell you statistically what people are doing. So if you look at couples or young people between 25 and 30 years of age, couples, they're engaging in sexual activity 2 times per week on average. When you get to roughly 50 years of age, it's about 1 time per week. And when you get to roughly 70 to 75 years of age, it's about 1 time per month. You can see the trajectory. What's interesting, though, on that slide is that as you get to 80 years of age, you start seeing an uptick. So if you live till 80 and you're healthy, you start engaging in more and more sexual activity on that graph. But the reality is that twice a week, I would say, would keep the tissue healthy. The problem is that women go through menopause at roughly 52 years of age. When a woman goes through menopause at roughly 52 years of age, there's a precipitous drop in her testosterone, which is one of the number one drivers for sexual desire. And there's a significant drop in estrogen in the vagina as well. So now she has a low desire for sex, and she has pain when she engages in sexual activity. So she doesn't want to engage in sexual activity. And thus, I believe men will start developing more atrophy of the penile tissue when their partners go through menopause.
My mom's 82, and I was giving her a hard time about this subject. We were just joking around the other day, and she said, Megyn, when you're 82, you can fulfill all of your sexual fantasies, and then you realize you don't have any. I mean, but you're right. On both ends, it's a use or lose it situation because like the less you do it, the less important it is to you. And the more you do it, the more you sort of keep everything alive and you want it more. I think that's true for men and for women. There's so much more to discuss. I want to get to libido. We have to talk about testosterone. You mentioned testicular cancer, infertility. And there's so many topics. The more I got into this, the more I was like, this is all fascinating and lots I want to talk to you about, including we'll spend some time on boys who are coming of age because that's tricky too in today's day and age. That dark spot on your face, is it bothering you? And the liver spots on your hands and those on your neck and your chest? Now you can watch them disappear safely and quickly in 3 quick minutes. Introducing the Genucel Dark Spot Corrector 3-step, 3-minute dark spot luxury system. By using their Cristal's world-famous microdermabrasion before the dark spot corrector and then finishing with a touch of the collagen-building Genucel XV, you will see the dark spots disappear before your very eyes, instantly, smoothly, and luxuriously. What you're watching on the screen are real results in just a couple of minutes. Don't take my word for it. If you're not blown away with the results, you'll get 100% of your money back. No questions asked. Free shipping, free returns. Go to Genucel.com/MK60. Order the new dark spot correction system. It's the dark spot treatment system today and say goodbye to those pesky spots tomorrow. All 3 products are included in Genucel's most popular package for August, so you get your Genucel bags and puffiness serum also included, all for 70% off retail. Experience the luxury and effectiveness of Genucel. 70% off while supplies last. Genucel.com/MK60, GENUCEL.com/MK60. Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.